Good morning. It's Tuesday, April 21st. I'm here with today's psychology lecture notes. The question of the day is, if a person is extremely active, excessively talkative, and easily distractible, she may be what? So if a person is extremely active, excessively talkative, and easily distractible, she may be what? Okay. Um, Getting ready to start anxiety disorders. I'm going to go through and talk about those specific phobias and kind of move through a little farther, get into panic disorders. I'm going to be posting the Beautiful Mind prompts today. Still working on things with that. I may try something tomorrow and see if I can do it without getting in some kind of trouble or something. I don't know. I'd like to be able to see if I couldn't figure a way to show it through here. I just don't know. Nobody's emailed me and said they couldn't get access to it. And I guess that's what I'm kind of waiting on. So I'll go ahead and get the prompts posted so you have that and put a date out there for this to be due, and then we'll see what happens. Okay. So let's get on with the notes today. Anxiety disorders. We are all afraid from time to time. We usually know why we are afraid, and this passes with time. With anxiety disorders, the person either does not know why he or she is afraid, or the anxiety is so inappropriate to the circumstances. In either case, the person's anxiety and fear don't make sense. Okay? You can have an anxiety attack and you don't know why you're anxious. You don't know why you have this fear, this overwhelming feeling that something is wrong and it's uncontrollable. So you may not know exactly why. Those who have anxiety disorders usually are on medication to help control their anxieties. I know a few people that are like this, and without their medications, they could all of a sudden they may have shortness of breath, an intense fear, almost debilitating. Okay, so this can happen. All right. We have special phobias are part of this anxiety disorder. Anxiety disorders are more common than any other form of mental disorder. Anxiety disorders can be divided into more specific diagnostic categories. Specific phobia, a paralyzing fear of something that perhaps should be feared, but the fear is excessive and unreasonable. The fear is so great that it leads the person to avoid routine or adaptive activities and interferes with life and functioning. Okay. I'm not sure if we'll give some examples here. If you're afraid of snakes and you're someplace and somebody's seen a snake and you won't go in that place anymore. Okay. You're afraid of roller coasters and somebody gets you on a ride and they tell you, oh, it's not a roller coaster. It's okay. And then it's like a roller coaster to you. And your specific phobia there could be so bad that you'll never go back on rides again. Okay. Because it's really messed you up for going on any kind of rides. All right. Social phobias refers to excessive inappropriate fears in social situations or performances in front of other people. Intense fear of public speaking is a common form of social phobia. It could be something as simple as talking with people or eating in public. It is normal to experience some mild fear or uncertainty in many social situations. But these fears are only considered to be social phobias when they're excessive enough to interfere with life functioning. How many of you cannot get up and talk in front of a group of people? Maybe you can get up and say a few words in front of your class in a classroom setting, but if you were asked to get up and give a speech at graduation, how many of you could not do it? Okay, that's part of that social phobia. Okay, agoraphobia is more debilitating type of anxiety disorder than social phobias. The term is from the Greek and Latin words that means fear of the marketplace. This disorder typically involves multiple intense fears, like the fear of being in public spaces in which escape might be difficult, being in crowds, being alone, traveling in an automobile, or going through tunnels or over bridges. The common element seems to be the great dread of being separated from sources of security. Okay. In today's society, it's easier and easier for somebody to have this and get by. I mean, look at us right now. Social distancing, stay at home orders, people working from home, teaching from home, and all this stuff. People can just have this and probably be just as happy as they can be because they don't have to get out. They don't have to go here and go there. So they can order stuff to be brought in. They never have to leave. But that's part of this phobia, okay? Panic disorder, characterized by recurrent panic attacks, sudden, unpredictable, and overwhelming experience of intense fear or terror without cause. A person may have feelings of impending doom, chest pain, dizziness, fainting, sweating, difficulty breathing, fear of losing control or dying. If the attack usually only lasts a few minutes, but can recur for no reason. And part of the problem is once you've had the attack, you can trigger another one by thinking that you might have the attack. Okay, and I know that sounds a little bit weird, but it can happen. Okay, panic attack cause tremendous fear and also leave the sufferer with the dread of having another one that can persist for even days or weeks. This dread could lead to agoraphobia. To prevent reoccurrence, they avoid anything that might cause anxiety. They cling to people or situations that help them remain calm. Agoraphobia develops out of their attempt to avoid further attacks. So they stay away from those things. Okay. Other anxiety disorders is the next thing we're going to hit on. Generalized anxiety disorder is prolonged, vague, but intense fears that are not attached to any particular object or circumstance. May come closest to the everyday meaning attached to the term neurotic. The symptoms include inability to relax, constantly feeling restless or keyed up, muscle tension, rapid heartbeat, apprehensiveness about future, a consistent alertness to potential threats, and sleeping difficulties. Okay. The next thing we're going to hit is obsessive compulsive disorder, OCD. Now you've heard about this one. This is pretty prevalent. Gets talked about a lot. Okay. Obsessions are involuntary thoughts or ideas that keep recurring despite persistent attempts to stop them. Compulsions are repetitive, ritualistic behaviors that a person feels compelled to perform. Obsessive thoughts are often of horrible and frightening nature. Compulsive behaviors may be equally dismaying to the person who feels driven to perform them. Common thoughts of washing or cleaning. Hey, here we are. And in a time when every time you turn around, whether it's on TV or the radio, or you do have to go out to Walmart and it talks about washing your hands, constantly washing your hands, cleaning surfaces. How many of you right now in your household have a family member that is just either obsessed or is just compulsive about wiping things down, washing this, washing that, taking care of all those things? Okay. So it can bring that on right now. For me, when I used to set an alarm, I would go to bed and I would check that alarm 3 times. Before I even got in bed, I'd make sure the alarm was turned on. I'd push the button and make sure it said what time. I'd first lay down in bed. I'd roll over and I'd touch that alarm, make sure it was on, make sure the time was set. And at least one more time, I would do it again. Now, obsessive compulsive behavior, maybe. I don't know that I'm OCD, but I think I have, and I think we all might have our things that we double check quite a few times. Before I go to bed at night, I always double check the doors. Even though I may have locked them myself, I double check the doors and I make sure they're locked. So there might be some of that compulsion a little bit in everybody. Okay. Another compulsion is checking and repeatedly performing some kind of behavior to make sure it was done in a certain way. If they try to stop or someone tries to stop them, they experience severe anxiety. So if you really had somebody that was OCD and they did a certain ritual all the time, if you tried to stop them or if they tried to stop, it could cause anxieties for them. Okay. The behavior seems to keep the anxiety at bay. two anxiety disorders that are clearly caused by some specific highly stressful event. First, if the anxious reaction occurs soon after the event, it is an acute stress disorder. If it takes place long after the events are over, the diagnosis may be post-traumatic stress disorder. So if it happens right after it goes down, it could be acute stress disorder. Okay, but you could have post-traumatic stress disorder, which happens a long time after the event. We see post-traumatic stress disorder in a lot of those who serve in the military. They get by while in their military, but when they finally come home, they start having problems after they've been home a while. Okay. They talk about 4th of July and setting off fireworks, that some who have PTSD have problems when fireworks are being set off. Okay. Vehicle backfires when they're walking down the street. A helicopter flies over and makes them think of a helicopter when they're military. Just things like that could trigger these anxious events for them. Okay. The attack usually lasts only for a few minutes, but could recur for no reason. Okay. Panic attacks. Let's see, we got that. Causes of anxiety disorders. Okay. Cognitive perspective. People who feel they are not in control of stressful events are more likely to experience anxiety than those who believe they are in control. Okay. If you believe you're in control, you may not have them happen as much. Okay. But those who don't feel they're in control will experience anxiety attacks more often. All right. The biological perspective points to heredity. A predisposition to anxiety disorders may be inherited. Some evidence exists that anxiety disorders tend to run in families, higher rate among identical twins compared to fraternal twins. Any comprehensive model of anxiety must account for what would seem to be the vital role of internal psychological conflicts. All right. Psychosomatic and somatoform disorders. Psychosomatic disorders are real physical illnesses that appear to have psychological causes. The term psychosomatic has two parts: psycho, mind; soma, body. Okay. Somatoform disorders are characterized by physical symptoms without any physical cause. Tension headaches are an example of psychosomatic disorder. These are muscle contractions brought on by stress. The headache is real. It is caused by a psychosomatic because psychological factors, stress and anxiety, appear to cause the symptoms. Okay. People who suffer from tension headaches are taught relaxation techniques. I used to get migraines. In 2008, when I lost the job that I had been working at for 17 years, the amazing thing was that it wasn't too long after that I quit having migraines. So part of the theory might be that the anxiety and the stress of the job that I had was possibly causing those migraines. Okay, so that's the key there for me, that when I got away from that area and got away from that extra stress and anxieties in that job, that the headaches went away and I didn't have migraines anymore. I couldn't tell you when I had one. I know it's been since 2008. So what, 12 years that I haven't had a headache like that, the severe migraine, because I got them bad enough that I'd have to go into a complete dark room and I'd have to lay a pillow across my head here so that it covered my eyes completely, and it was just total darkness. I just had to lay there and lay still. Medication that I took never really worked. It was just that stillness and not moving in total darkness to help get it to go away. Okay. Scientists used to believe that psychological factors contributed to some of the physical illnesses, headaches, allergies, asthma, and high blood pressure, but not others like infections and diseases. Today, modern medicine leans toward the idea that all physical ailments to some extent are psychosomatic, believing that stress, anxiety, and various states of emotional arousal alter body chemistry. Okay. Somatoform disorders. Those who suffer from somatoform disorders are not trying to mislead others about their physical condition, but symptoms are not real to them. One kind of disorder is somatization disorder. A person experiences vague, reoccurring physical symptoms. No cause can be found. They complain about back pain, dizziness, partial paralysis, abdominal pains, and sometimes anxiety and depression. There's an example on page 502 in our book that I'm going to kind of read for you. An elderly woman complained of headaches and periods of weakness that lasted over 6 months. Her condition had been evaluated by doctors numerous times. She was taking several prescription medications, and she actually had undergone 30 operations for a variety of complaints. She was thin, but examination showed her to be within her limits in terms of physical health, except for numerous surgical scars. Her medical history spanned half a century, and there can be little doubt that she suffered from a somatization disorder. Okay, 30 surgeries, and she still had complaints, all kinds of medication that she took and stuff. Okay, so that was just an example of one of those disorders. Another somatoform disorder involves paralysis, blindness, deafness, seizures, loss of feeling, or false pregnancy. This is called conversion disorder. They have healthy muscles and nerves, yet their symptoms are very real. Another somatoform disorder is hypochondriasis. The person insists some small symptom like a cough, bruise, or perspiration is a sign of a serious disease. The symptom is made real. The symptom is real, but there is no evidence that the serious illness is. Body dysmorphic disorder, or imagined ugliness, is a recently diagnosed and poorly understood type of somatoform disorder. Read example in the book here. One man, for example, felt that that people stared at his pointed ears and large nostrils so much that he eventually could not face going out to work and quit his job. Okay. I will tell you that I went to school with somebody who thought that this part of his ear hung down too far and was flapped around too much, to the point that for a while he tried taping. He would try to tape his ear down so it didn't do that. And finally, his parents, after exhausting all the resources that they had trying to get him over this, finally had plastic surgery done. And he had this attached to the side of his head so that it didn't flap around. Okay, so it was just there. And there are some people that their earlobe is attached. Most people have a little bit of an earlobe, but he had to have his attached to his head because it was that kind of a disorder for him. Okay. Now the causes of these disorders cause problems for psychological therapists that involve some kind of unconscious process. Okay. Got an example here for you. A woman who years earlier saw her mother physically abused by her father suddenly loses her sight. A man who was punished for masturbating later loses the use of his hand. By unconsciously developing a handicap, Freud theorized people accomplish two things. First, they prevent themselves from acting out forbidden desires or repeating forbidden behavior. Freud called this the primary gain of the symptom. Second, the symptoms often allow the person to avoid unpleasant activities, person, or situation, and Freud called this a secondary gain. Okay, so cognitive behavioral theorists of somatoform disorders focus on Freud's idea of secondary gain. They look at ways that the symptomatic behavior is being rewarded. A person may have learned in the past aches and pains can be used to avoid unpleasant situations later in life. This person may use somatic symptoms to avoid unpleasant or stressful situations. Usually people who are ill often enjoy a good deal of attention and support and care. Okay, so maybe they're ill because they want that attention. If they feel they show the illness, someone will pay attention to them and they will get that extra attention that they're needing. Okay, the biological perspective, research has shown that some somatoform disorders were real physical illnesses that were overlooked or misdiagnosed. One follow-up study has indicated that some causes of conversion disorder were undiagnosed neurology problems like epilepsy or multiple sclerosis. Okay. Still, most causes of conversion disorders cannot be explained by medical science. Okay. I'm going to go ahead and stop there for today. We'll start off with dissociative disorders on tomorrow. I want to let you know that I spent the biggest part of my morning going through the grade book and getting grades completed and taken care of. I need to tell you that you need to check Skyward. And not only with my class, but check Skyward with all your classes. If you have incompletes in your grades, these are going to be reported, especially if you're a senior, reported to the counseling in the principal's office by Friday. And I don't know how that's going to play out. Seniors, you only have a couple more weeks, okay? Your last day is the same as it was doing class like this as if we were back at the high school doing class there, okay? You need to get on your grades. You need to make sure you don't have incompletes. If you have incompletes for me, you contact me. I'll make sure you get all that work, that you can get it done, get it graded, and get it turned in, okay? Don't take a chance. Like I said, I don't know how they're going to handle this, okay? It's above my pay grade to make that decision. I'm just warning right now that if you have incompletes and you can't do them through the teams, get a hold of me and I'll get you to work so you can get it done, okay? Hope you all stay safe. Have a great day, and I'll be back here tomorrow. Bye.